Professor Catherine Bennett says there's no epidemiological reason to say people within a heavily populated community must stay within 5 or 10 kilometres. This is the case. Why is there still the 5 kilometre radius rule?
Well, with the greatest of respect to Catherine Bennett, she's not the Chief Health Officer.
So
She can have views, lots of views. I've got to say to you, I'm not getting into this modelling debate again. I'm just not. We've got a series of decisions that have been made. This strategy is working. The numbers are coming down, and there are aggregate benefits that come from each and every one of the different measures that we've taken. They're taken on health advice. That doesn't mean that every health professional, every person from public health across the world would necessarily agree with every decision we've made, but you have to call it. You have to call these things, and that's exactly what we've done.
Why can't you explain the health risk of someone travelling more than 5 kilometres from their home?
Movement means virus. It's as simple as that. It's about reducing movement. That's what stay-at-home orders are all about. That's what just about every single one of the measures we've put in place, it's about reducing movement. If you've got more virus out there than you know, and that's a product of the fact that not every person with symptoms gets tested. What's more, not every person who has the virus gets symptoms. So if you have more virus than you have in terms of numbers, that is cases you know of, cases you put a public health response, you've wrapped your arms around them, then if people are moving freely, then there is, logic just tells you, there is a greater risk, a far greater risk of people infecting others, and not just infecting people in their own family or in a circle that can be pretty easily traced, but infecting people that they have never known and will never know. It's nothing more or less than that. It is simply common sense. And it is very difficult to disaggregate each of the different measures that we've taken and apportion to each of them a separate public health return, if you like. That's very challenging.
Can I just ask a final question?
There is an aggregation of this and a cumulative benefit.